Often it happens that your illness or sickness may not require a lengthy and expensive hospital stay, but you still need the managed care of a healthcare professional who can assist you with your recovery. That's when you need to call the VNA of Maryland. For more than 100 years, the Visiting Nurse Association of Maryland has been providing compassionate and comprehensive home care services so that you can recover safely and in the comfort of your own home. Here with more on how the VNA can help you is Cindy Bach and our Cindy Bach and Teresa Clark, rather. How are you?
We're great. How are you?
Happy to have you both here. So tell me more about the VNA of Maryland.
Well, VNA of Maryland, as you said, has been providing services for over 100 years in the state of Maryland in folks' homes. So we provide nursing and therapy services in the comfort of your home when you might have an illness or after surgery. But one thing for sure is VNA of Maryland is very committed to serving communities in need. And in this last year, we've expanded our services, not just in Baltimore City and around Baltimore, but also into the southern parts of Maryland, into Calvert County, and onto the Eastern Shore. Within the last year, we've expanded onto the Eastern Shore. So we now provide services from Cecil County all the way down to Dorchester County. So we're serving more of our community.
That is amazing. And this expansion came, why? Just because you saw the need or you were getting the requests? I mean, that's a lot to take on.
Probably both, but part of it is healthcare changing. There is a need for us to provide services in the home because healthcare has changed. Healthcare has made advances, and now people who want to be seen in their home, and most of us do, we'd much rather be in the comfort of our homes when we're recovering or not feeling well. But now with some of the things that have happened in healthcare, more and more folks are home earlier, they're leaving the hospital earlier, and sometimes don't even have to go to the hospital. An example would be a joint replacement. It wasn't too long ago someone had their joint replaced and they'd be in the hospital maybe for days or weeks to finish recovering from the surgery and some therapy before going home.
Yeah.
We now see people who have surgery same day. They may go in the morning, and we need to be there later in the day to greet them and make sure they're safe in their home, and any questions about pain control or how they should be moving safely. So that's an example of how healthcare has changed, so we need more people in the home to respond to those needs.
It's just amazing. And then the services that you provide as well. Describe to me what someone could use you guys for.
Well, at the VNA of Maryland, we have nurses, RNs, that can come right to see you right in your home, in the comfort of your own home. Our nurses can address disease process teaching. For example, if you have hypertension, heart failure, COPD, diabetes, we can do the education right in the home. We also see patients who have wounds. We can do IV infusion. Anything really that you need from a nursing standpoint, we can provide.
You can't do all that at home. And I love that because I feel like you do recover better when you are surrounded in a familiar setting, your loved ones, your food, all of that is all beneficial to feeling better and recovering better. So when someone wants to get in touch with you, what do they do if they know that the surgery is coming up, or maybe it's a last minute need all of a sudden? They didn't expect that they would need this service, but now they do. How do they get in touch with you?
You want to go ahead with that?
Well, sure. We do go with the referral from a physician.
Okay.
So that really is coordinated either at the hospital at discharge, or you can call your physician. Call your physician and say, you know what, I'm just not feeling as well as I should. It's getting harder for me to leave the home. Maybe a little less steady and a little harder to get down the stairs. That might mean a visit to your physician or your provider so they can check things out and say, I really would like to have some in-home care because it's really hard for me to leave the home. They would call us, and we would then send a nurse out who would do an overall assessment, or a physical therapist, and our whole team can come in and assess what needs there might be to keep you as safe and healthy in the home as possible.
Just super, super empowering that people can have this service now and not just rely on hospitals, that they can recover at home. Thank you so much for what you do and for being here today.
Oh, well, thank you.
Really appreciate it. And we'll be right back with more Midday Maryland right after this. Stay tuned.